Hi, this is Dr. Schuster with your tip of the week. This is part two of people I work with and hopefully make me look good. Don't you hate it when you call up somebody and you get a call center in India or Nashville? Don't you hate it when you call somebody and you get a computer you have to talk to for 5 minutes and then you get a live person who asks you the same questions? And nowadays, don't you hate it when you call somebody and you get a call center and then you find out it's not even really the doctor's office? I called Yale a month ago to speak to one of their surgeons and was on hold for 15 minutes and finally found out the call center answered, and then they put me through to the office where they kept me on hold for 5 minutes, and then they told me the doctor wasn't there. So I want to start by introducing you to our executive assistants. They used to be called secretaries. And not only do they do a great job, but they actually answer our own phones.
Hi, I'm Mary Ann. I worked at Stanford Hospital for many years for Dr. Marcia Bull. I've been with Dr. Schuster now for about 27 years. I answer phones, schedule appointments, book procedures. I run Dr. Schuster's schedule. I also work with Dr. Sy, Dr. Martin, and Dr. Miller, scheduling procedures, booking appointments, taking co-pays, and making sure every patient is well taken care of and comfortable from when they come to when they leave.
Hi, I'm Gabe, and I am an administrative assistant to Dr. Schuster, who works at the front desk. I started working with Dr. Yap at St. Joseph's Hospital, and I've been here at the Tully for 5 years. We do scheduling for the office and for the hospital for testing. We try to keep the office running as professionally as we can to make your visit and stay with us very inviting. We also work with Dr. Martin and Dr. Sy. They also come here a couple of days a week, and we do the same for them, doing the office visits and the testing. We also make sure that we have all your updated information, especially your insurance. That is very important, so that we have everything on hand for when your testing is available, so that we know that we have the right insurance information. And that's what we do.
Stress tests are an important part of cardiology, and the people who help us do stress tests are very important. Patients get scared when they come here for a stress test. They're worried something could go wrong. So the people who bring them in, get them set up, watch them while they're running on the machine, take their blood pressure, and keep an eye on them and make sure they don't fall and nothing bad happens to them. These people, the stress test technicians, are a very important part of our team.
Good afternoon. My name is Lola Oliver. I'm one of the cardiology techs here, and this is Alana.
Hi, how are you? My name is Alana. I'm one of the techs as well.
We're responsible for assisting Dr. Schuster in bringing all of our patients quality stress testing services. I not only am a cardiology tech, as you can see up here, I'm a non-invasive cardiovascular tech, also giving you that extra security in the work we do. Our responsibility is to prep the patients, go over the medical assistance sheet, updating any information that Dr. Schuster may need, and we also prep the patient for multiple stress testings that we do. We assist them on the treadmill, making sure that safety's first and they get quality results and accurate testing.
Sometimes we want to look into somebody's heart. We want to see how the heart muscle is squeezing, how the valves are working. We can do this with an echogram. So we'd like to introduce you to our fantastic echo tech.
Hi, my name is Debbie. I work here at Tully Health Center and I perform echocardiograms. What the echocardiogram is simply an ultrasound test where we use high frequency sound waves to look at the valves of the heart, the chambers of the heart, and the blood flow in the heart. So all of this is useful in the assessment of cardiac anatomy and heart function. All of this information is useful and very important to the cardiologist. It helps and assists them with diagnosis, management, and follow-up of their patients with heart disease. It truly is an invaluable tool.
Lots of times heart patients need stress tests. What I tell them is when you're going to buy a car, you don't just look at it, you need to take it for a drive. So that we do lots of stress tests on our heart patients to make sure they're okay. The nuclear stress test is the most sophisticated stress test we do. So I would like to introduce you to our nuclear team.
Hi, I'm Kim Fornell,
And I'm Becky Legan.
and this is the Stanford Hospital Tully Health Center Nuclear Medicine Department, which is where we do nuclear stress tests of your heart. And what that means is that when you come to us, you'll exercise on a treadmill for a few minutes, or you'll get an injection that does the exercise for you. And after that, you'll come and take some pictures of your heart. And to take those pictures, you get a little bit of radioactive material injected into a vein. And it makes you feel nothing, it has no side effects, no reactions. This is the camera that we use to take the pictures, and it takes about 15 minutes, and we see the blood flow to the heart.
So hi, this is Dr. Schuster. Thank you for meeting all the people I work with. They are great. Next week, we're going to show you the Tully Center, where we work. Buildings are important also. And then we'll get back to our medical tips of the week.